Hi, my name is Martha. I'm an occupational therapist and I work in home health. Let's just talk a little bit about what that means. A lot of times people are qualifying after a hospital stay, but some people get it just because their doctor is worried about them at home. You could get physical therapy, nursing, occupational therapy, speech therapy. We also have a medical social worker at our company. If someone is telling you that you only get 2 visits before they've even met you, you need a different company. The company I work for is very large and we are a nonprofit, so we don't do that kind of thing. But some do, because it is the company trying to hold more of the money that they are getting from the insurance. And they, a lot, clinicians, a certain number of them, which is really, really not okay. It should be driven by what you need. We are supposed to see you in a timely fashion, so that's why sometimes when we're pushing to do the evaluation, it's because the doctor is expecting us to get there and insurance needs us to get there. There are certain time frames for things. Help us out with scheduling. Everybody is overwhelmed when they come home. They have a lot of paperwork from being discharged. They are being pushed to get to their primary physician pretty quickly, mostly because they're going to change a lot of your medications when you're in the hospital, and they need you to get back to your primary to get everything back on track. You don't recognize the phone numbers. You don't recognize the names when people call, say, hi, I'm this person, I'm that person. We know, and it will be easier when you know our faces. But also know that these calls are going to be coming in. You are going to be hearing from the nurse and the physical therapist and the occupational therapist. So even though you like to screen your calls, please answer the phone. We can't wait to meet you. So let's get that worked out. Also, we try to accommodate times as best we can. We really do. Some people don't want to be there when their favorite show is on. Some people aren't morning people. Some people have really, really strict times for us that are not reasonable. Work with us. It is a medical appointment. I always say that people talk about it like we're trying to meet for coffee. So I'll say, hi, I wanted to be there between 2 and 3. I think you should come in the morning. Oh, well, I've already scheduled 5 people in my day, and I can't do that. I'm covering a very, very large area, and sometimes I have wiggle room in my schedule, and sometimes I really, really don't. But after the evaluation, when I know what your needs are, then I really will try to find the days and the times that are going to suit you. I'm going to do that as best I can, I promise. But sometimes it's going to be imperfect because it's an imperfect world, and I have to see a lot of people, and you have a lot of appointments, and we're going to work things out together. The basic idea in home health, we want you safe in the house and able to get out of the house. That's basically what we're trying to do. And so when we'll know when it's time to discharge you, that's really between you and each clinician. And then when it's time to move on to outpatient, if it is, we will guide you through that too. This is just a basic intro to what we do, and I'm going to have some more videos. Thanks.